Imma issa nixtieq nkellem ftit il-Dr. Susan Vasloo għaliex permezz tal-istorja tagħha ħadd tkunu tafu wkoll kif professjonisti bħal din it-tabiba ma tħallewx jagħmlu xogħolhom. Ġifieri professjonisti li anki kważi teħdidilhom mhux kważi teħdidilhom il-liċenzja u ġabhom darhom mal-ħajt biex ma jaħdmux. Ma let's leave it up to Dr. Susan Vasloo to relate your experience and how you got involved in all this.
Thank you, Stephanie. Thank you firstly for allowing me to participate in your lovely program.
Thank you.
During 2020 and 2021, especially with heavy lockdowns, there was a huge reduction in the number of, for instance, surgeries being done in my field. We were able to do what so-called emergencies, but we also treat patients from neighboring countries. Those people could not fly, and those babies never actually came to any surgical correction help. So our practices were slower, and we had a lot of time to read and be quite informed about the medical side of what was happening in the world, because nothing made sense. During 2021, we were offered the vaccination, and by then we had some reservations and we politely declined. So immediately, once labeled in the way people were labeled who did not comply with instructions. And then a friend asked me if I would mind speaking to her father, who was intending to take the injection,
yes,
which by then clearly was not really a vaccine by definition, but the definition evolved so that what is really gene-based therapy was labeled a vaccine, and I'll come back to that later. So because this is not my field of practice, I declined giving any advice to any patients, even my own patients. But what I did do is to share with them publicly available information which I read and which I considered of value. So when we met, I met with my friend at the time that you could not meet people in person. So the meeting was a Zoom type meeting where some friends, some of her family, some people I knew, some people I didn't know. And the question she asked me was, is there any potential risk in taking this medication? Which I then shared with them the potential risks, which are now really well known. But at that time, there only was really early evidence: the myocarditis in young patients, the neurological complications, the complications related to coagulation with people having bleeding and blood clots, the effect on reproductive system. All those concerns were known well in advance, and one could already notice in society certain adverse events happening. Now, somehow this supposedly private conversation became public, and it became a huge public event in our country. And this was followed by a massive attack on me by the media. And already by that time, one did observe anybody that came with valid arguments were immediately attacked as the messenger. Like, we grew up in a country where racism is a factor. So immediately when you label somebody racist, it's the end of the conversation. When you label somebody anti-vaxxer or conspiracy theorist, there is always the attack on the messenger, but the inability to bring an alternative argument. So I was more or less prepared for that, but then followed a huge actions taken by my regulatory body. It's called the Health Professions Council in the country, and they have the ability to cancel your license to practice. So I won't dwell on that, but I was charged with very wide charges, which basically said, we don't like what you said, so for that reason, you are unprofessional and irresponsible. So I said, okay, let it advance to a formal hearing, which has never happened now 4 years later. And even when the lawyers that represent me write to the council, they do not even get acknowledgement of their letters. So I hope that we will now be able to approach the High Court to ask them to either get along with this proceedings according to their own procedure or to dismiss the case. So I'll leave that there. But I think it was a message for colleagues and a lot of junior colleagues, for instance, paid fines, they were threatened, they were even I would not say much, but I also never did because it's not my field of practice. But I do not think sharing correct information with somebody in an informal way is really also for your regulatory body to take these steps to discipline you for something that has nothing to do with the practice you are doing. So this is how in 2022, well, I think in 2022, when the World Council for Health was established, I joined it. The difference between the WHO and the World Council for Health is basically that in the WHO, it's a central body that instructs everybody to do the same thing. It's like a one-size-fits-all. But if you manage patients and individuals, not everybody is the same. Not one cure works for everybody. The other concern is that a lot of these advice were shared by bureaucrats, by celebrities, and people with no training in health. And unfortunately, many individuals in society were compliant with this, but we can later speak about what is the future for us all.
And that is where it became fishy. Okay, apart from the scaremongering, not only to the people, but also to professionals, because they were literally threatening their careers. But when there was this enforcement and being pushy on, you either take it or you can't go abroad, or you either take it or you can't mingle, and you are an anti-vaxxer, or this is when it started to become fishy, and people are not stupid.